Hi, I'm Dr. Christiane Siebert, a licensed acupuncturist here in New York City, and I'm so happy to have a chance to speak with my friend and colleague, Dr. Sneha Gazi today. She is a physical therapist, and we'll talk about a whole bunch of things that are relevant to women's health. So welcome, Sneha.
Thank you so much, Christiane. I'm so excited to be on this show or video chat with you right now for the audience, and especially excited to educate everybody a little bit about pelvic floor physical therapy and what it's all about.
Great. So yeah, you already opened up really nicely, and I'm curious, what's the pelvic floor? A lot of people don't actually know what that is.
Yeah, so I'm going to show you with the model really quick. Pelvic floor is, so I'm just going to orient you to this model. This is your spine in the back. These are your hip bones where you put your hands on your hips, where people usually say that. And then this is your pubic bone, and then these are your sit bones at the bottom. And the pelvic floor is really encompassed of all of the stuff that's underneath and in between this area. You see most of the stuff that's red, it's muscles. So the pelvic floor consists of a couple of different things. It's the muscles, it is the ligaments and the structures basically that hold one part of a bone to another part of a bone. There are nerves, there are blood vessels, there's fascia, which is basically a fancy word for connective tissue that holds things in place. It's kind of like saran wrap that just kind of keeps things together. And then there's also all these bony structures around this pelvic floor area that kind of situate and orient the that area.
So what does the pelvic floor do?
Yeah, so the pelvic floor does a lot of things. The main things are support, because it sits right underneath. Basically, if you were riding a bike or you were riding a horse, that whole area that you're sitting on is your pelvic floor. So it's really providing support for everything above. So your head, arms, your trunk, your abdominal organs, your lungs, your heart. It's supporting the weight of all of those structures. And then it also functions for bowel, bladder, and sexual function as well. So in those areas, that's where you're going to get elimination. That's where you're going to get sexual satisfaction, reproduction, and it's supporting all of the reproductive organs as well in that area.
Yeah, so that is actually a topic that's of great interest to many of my patients and people in my audience who are struggling with conception and childbirth and pregnancy. So are there any issues that you come across in your work that people should be aware of and could learn more about to just function better?
Yeah. So when it comes to pelvic floor physical therapists, just to give you an overview at least of what we do as a profession, we are regular physical therapists. We treat everything that normal physical therapists treat, like back pain and knee pain and ankle pain, all those things. But the thing is that we also take into consideration the pelvic floor and how that could be influencing every movement. So the reason why we're so big about our profession is that we are including a part of the body that a lot of people are kind of ignoring because it's a sensitive area or they don't want to go there. And pelvic floor physical therapists take the whole picture into consideration. When it comes to what we do, it's just similar to exactly what you would hear as any physical therapist, that what they do in their normal plan of care. So we do evaluations of the entire body. We do test the range of motion and the strength of your muscles. And then we devise a plan of care that's right for your body and that's personalized for your unique characters of your muscle tissue and of your range of motion. The thing is that we're looking at an area that's not as easily accessible and is a little bit harder to see, and obviously incorporates a sensitive part of your body, and that's very intimate. So when it comes to what pelvic floor physical therapists do when it comes to reproduction and intercourse, one of the biggest things that we look at is making sure that people can have safe and pain-free intercourse and making that comfortable.
Yeah, that's really helpful because that's a big concern to many people. It's a sensitive area, and also not something that people want to talk about really easily. And then on the other hand, it also often gets in the way of a satisfying sex life. And by extension, it can also get in the way of actually procreating, having babies. And so it's definitely a huge topic and something that people need to learn more about, and also find out, how they can get help if it's not working for them. So maybe that we can use that as a segue to hear a little bit more about your work, your practice, and also specifically how you work with women who have these issues. Not to mention, of course, that men can also have issues with pelvic floor dysfunction, but the majority of people that we work with tend to actually be women who take the lead in terms of improving sexual function and their ability to conceive. So take it away.
Absolutely. So yeah, to your point, we treat anybody who has a pelvic floor, which is everybody. And it kind of goes both ways, because sometimes the issue is on the male side of things, where they're not able to have intercourse pain-free, and that could be preventing the family as well. And so on both ends, there's a lot that you can do. And so I'll just tell you a little bit about my practice. I am a pelvic floor physical therapist that does in-home and telehealth visits. In-home is really great because you get to really see people in the environment that they live in. So if, for example, like some of my postpartum moms, if they're having pain, breastfeeding, or picking up their baby, it's so easy to see that and help them directly on the spot. Also, it's a very, like we talked about already, it's intimate and it's a sensitive area. So that if you're in the comfort of your own home, sometimes people just feel a lot more calm and relaxed during the session.
Yeah.
So
and I know also that you just make them feel relaxed and calm.
Yeah, because it can be frightening. It's it's a very, it's nerve-wracking to think, oh, I'm peeing myself, or, oh, I have this bowel issue, or, oh, I'm not able to have intercourse with my partner, or, I have pain when I sit on the toilet, and all these things in this area may be really affecting them. And then when it comes to fertility and reproduction, that has a whole emotional component to it. There are a lot of people who are really struggling to conceive for a long time, or there may be people who have suffered from sexual assault or survivors of trauma, and then they're coming into this space. And so there's a lot of things that happen. It's a very much of a psychosocial thing that we're dealing with here. And so just being compassionate, empathetic, and understanding where the person is coming from, and understanding that it's not about the PT, it's really about the patient and what are their goals, what do they want to achieve. Someone who wants to have a baby is very different from someone who their goal may be, I want to run a marathon, and the pain might still be in the same area, and the person might look exactly the same from head to toe. Not exactly, but mostly the same from head to toe, right? So in my practice, we're really like taking in all of that into consideration, understanding the person's emotional component to everything, what are their goals, and then looking at the scientific part of everything, which is what are we presented with. We do a full body evaluation, looking at all the components, like I mentioned, and then the pelvic floor evaluation, and then devise a personalized plan of care for that person. Now you might ask, what does that look like, right? So let's just take into consider, there are so many different diagnoses and different cases out there, but if we're just looking at what we're talking about today, which is fertility and reproduction. If you look at somebody who, like, let's just say we have a woman who's coming in and she is having pain with intercourse, or she's having issues finding sexual satisfaction. Sometimes the issue is at the pelvic floor. Not always. There are times where it might be a hormonal issue that maybe someone else needs to be referred, you need to be referred out to someone else. Right. Or it could be a dermatological condition, like, for example, lichen sclerosa. There may be other skin sensitivity issues that's outside of the scope of physical therapy practice. But when it comes to the actual muscles, and when it comes to pain in those areas due to a restriction in the muscles or weakness or both, that's when PTs are really going to be the champions in those cases, because there's so much that's treatable, and a lot of women are just quiet about it. They don't want to talk about it. They're very scared to bring it up, and they don't want to, for fear of embarrassment or guilt or all of these emotions that are coming out. So they may not be talking as freely to, for example, their OBGYN or their families for fear.
Yeah.
And so pelvic floor PTs really put the information out there for them. We tell you, this is okay. It's okay that you're feeling this. This is very treatable. And it just takes a little bit of time and effort and calming down of the nervous system. So that it could include we might be working with dilators. So say that the person is just extremely wound up. This woman is very tense. She's very nervous because this experience is already painful for her. She's not able to conceive naturally. She wants to, and everything is medically okay with her. Mm-hmm. But it might just be that the muscles in the pelvic floor are just mechanically obstructing for that to be possible, right? That's probably one of the most straightforward cases to look into. Because
well, that's great to hear, because that gives hope to people, you know, who think it's not going to work for them, you know.
Yeah, exactly. It's very straightforward because we're just looking at probably an emotional component that's causing the tight muscles, or vice versa. Mm-hmm. So one group of people that I partner with a lot is cognitive behavioral therapists that are kind of specialized in this field that can help me if there's sort of a mental health component, and kind of strategies and behaviors that we can work with when it comes to becoming comfortable with their partner and being okay with things, having strategies for partners to work together to make conception possible. But when it comes to the mechanical part of everything, that's the best place that we can intervene. So we may work with dilators. Dilators are basically little, objects that are very comfortable and come in multiple different sizes that may be inserted to slowly expand and desensitize the tissues in that area that may be hypersensitive because of anxiety or pain or just physical tightness in muscle tissue. Mm-hmm. So it's basically like, I always say that dilators are almost like synonymous with foam rollers, or like the rollers that you would use on your IT band. It's just for your pelvic floor though. And it's very gentle. And so we'll teach patients how to use that, make them comfortable with it, and then work their way up to being able to take on larger and larger sizes that match their partner's size. Mm-hmm. So this sometimes becomes like a very funny conversation with the patient, but it's just part of their healthcare plan of care, really.
Yeah,
It's
I
just
think
getting
part
them
of it is really for people to become comfortable with the conversation, right?
Exactly. That's pretty much 90% of the battle.
Yeah,
yes, it's definitely 90% of the battle is just having those conversations to make people and their partners comfortable with what's going on. So dilators are one thing that work. The other thing is manual therapy. So the physical therapist, myself, we may insert our fingers either externally or internally into the pelvic floor areas, just like we would get a soft tissue massage for the back when it's tight. It's the same kind of a thing. There are multiple different medical techniques that help release the muscle tissues and the structures and improve mobility and blood flow, so that intercourse can become less painful and more comfortable.
Great.
And then there are series of desensitization exercises and relaxation techniques to really just calm the body and let the person become more comfortable and just feel more in tune with their body and feel more happy with their body. Sometimes there's a issue with body image when it comes to intercourse, and that may be preventing people from really having a pleasant experience. It might literally be a hip issue. Sometimes people's hips are very tight. That's preventing them from engaging in pain-free intercourse. There's so many reasons. So that's how useful that full body evaluation is, because a PT is going to take a look at all of those things, and really take a look at the person as a whole and figure out what are all the components that could be causing this. And if there's something that's outside of the PT scope of practice, we're going to make sure that you get the help that you need. And then all of the things that are within the scope of practice, we're going to help you reach your goals one at a time, slowly but surely.
Great. Well, I'm really impressed with your holistic view of these challenges that people experience. You know, you really take a look at the whole person. That's something that we both have in common in our work. And I think that should really be encouraging for people who are struggling with these issues, that, you know, they're in good hands with you. They really get a full evaluation and good guidance, and then also really specific help with their problems. So, yay! Sneha, please let us know how people can reach you, and we'll put this information also below the video. But tell us how people can reach you.
Sure. They can definitely visit my website. It's www.snehaphysicaltherapy.com, or they can shoot me an email directly at sg@snehaphysicaltherapy.com. If you go to the website, there's also a consult form that you can fill out. Everybody who, before they start working with me fully, they get a 10-minute free phone consult. Even if you don't choose to work with me and you still want 10 minutes of just understanding what's going on with you and seeing if you're a candidate for physical therapy or something else, I'm happy to have a conversation with anybody. And there are tons of resources. I have a podcast that I have lots of information for, especially the pregnant and postpartum period for women. And I have blog posts on my website as well. That
You're also very active on social media.
Yes, and I do a lot of Instagram lives.
With you, that's great.
Exactly. You can follow me on Instagram at Sneha Physical Therapy and DM me. So tons of resources and tons of information. And even if you just want education, I can link you to lots of articles and patient education, like pamphlets and links that people can just learn more. Because I think the most important thing is that when you know what's going on and you at least have a sense of it, you're just empowered to just feel more comfortable and know that you have a plan ahead of you. I think the worst thing is when a patient doesn't understand what's going on and they're kind of just living in the dark and suffering in silence. But there's no need to do that, because there are tons of people who are A, going through the same thing that you are, or B, that can help you with that very specific problem.
Great. Yeah, it sounds like you're really a wonderful resource. And, you know, to close up, would you share some words of wisdom before we close?
Yeah, sure. I think that the biggest word of wisdom that I would have, at least in terms of pregnancy or conception, is that don't be afraid to ask questions to healthcare providers and get multiple opinions on what's going on. Kind of referring back to what I said, you have to be an agent of knowledge within yourself to ask those questions and not be afraid of, you know, anybody telling you something and then feeling fearful about it. I think the more knowledge and the more information that you have, actually, I find that more so than not, patients feel more comfortable with what's going on with themselves, especially when it comes to something as intimate as intercourse and reproduction. So ask those questions. Don't be afraid. Don't do the late night Googling and then freak yourself out, but ask people who really know what they're talking about. Talk to your OBGYN, talk to your midwives, and let them connect you to people like acupuncturists, the work that you do, people like physical therapists, nutritionists, different people that can support you through this journey, because like we know, it's a holistic process. It's not just one thing. There's a lot that comes into it. So get the help that you need and really ask and seek the help yourself.
That's great. Thank you so much. It was wonderful to have you, Sneha. So I really enjoyed our conversation. I learned a lot of new things, so that's great. And we'll continue our conversation some other time. Have a great day.
Thank you. Thank you.